Look, it's all about the staging and the grading of the endometriosis, and I look at it as well as, the multi-systemic involvement. So, you can have a woman, I guess, let me just backtrack. You can have a woman that has minimal pain, but severe endometriosis, so she doesn't even really realize what's happened,
Mhm.
and she can take a very long time to conceive. And then IVF ends up being her only option because, the IVF is right through her reproductive cavity to the point where, her ovulation ability gets compromised, or other variables. Or you can have a woman where her pain is significant, but the endometriosis is mild. And that's where endo is not clear. And when you look at the research and they talk about, the pain awareness and the pain perception of endo women, there's not a direct correlation. There's not a direct, you have distinct pain, so you have distinct endo. And some of it relates to the neurological fiber involvement, the severity of it, your genetics, lots of other variables will influence it. So it's very tricky for us to go, okay, you have endo, you have infertility. It's not exactly that clear. The unfortunate thing is, if you have a laparoscopy, there is a definitive diagnosis, but then there's the recovery from the laparoscopy. And so
Mhm.
endo women are more prone to developing adhesions, which is abnormal scar formation, which then grows endo. So
Mhm.
you want to discourage the laparoscopy as much as you can, but obviously in some situations it is needed. And so, once you have the diagnosis and they have their clean out, as they lovingly put it, where they have the surgical scraping and everything, they do have increased fertility. So there's benefit to it in some situations. But to bring it back exactly to your question, it's just one of those situations where we have to investigate thoroughly and we have to ask lots of questions and really understand each individual woman to understand her fertility impact.